Hello and namaste. So today I'm going to talk about one of the most important joints in our body. It is the pelvis. I will talk about its structure, okay, and I will talk about the various dysfunctions that it can have. And please stay till the end of the video. I'll also tell you about the various exercises that we can do in order to keep it healthy. Okay, so let's start with the structure. So if you see the pelvis joint, this is our pelvis joint. It's right in the middle of the body. So you have the two hips here and the legs falling down, okay? Then you have the spine, okay? The end of the spine attached at the sacroiliac joint. So these are the two sacroiliac joints, right and left, and it is attached right at the end of the spinal cord. And this is your lumbar spine and your thoracic spine and your cervical spine. Now the pelvis works in a very interesting way. It can either, so let me demonstrate it. When you are bending down, you are bringing an anterior tilt in your pelvis. So if this is your pelvis floor, when you're bending down, you're bringing an anterior tilt, or when you're going back, you're doing a posterior tilt. Okay, so the pelvis goes back, okay, you go up a posterior tilt. Now when you turn, suppose you're doing a turn, okay, then the pelvis moves in a very different way. So if you have these two, the right hip and the left hip, when you move in a certain way, these can move individually. Okay, now this is where it gets interesting, because this can create dysfunctions in your body. So especially if you're playing golf, cricket, badminton, sports, or any other sports activities, or if you're running, or if you're using if you're used to sitting in a one particular way, okay, many of us sit with one shoulder up by taking a hand rest here. So if you are used to sitting in a one particular way, so all of these can create dysfunctions in your body, okay, and this is literally seen a lot in your pelvis joint. What are the various dysfunctions? One is if your pelvis is permanently tilted at the back, okay, if it is permanently tilted at the back, you will have a flat back. Your curve, this particular curve will miss, okay, so you will get a flat back here, okay. So this is seen in many ankylosing spondylitis and rheumatoid arthritis patients. Now if your pelvis is tilted overtly in front, then you will have issues here also. And yes, you can individually tilt these two joints here individually, and that can create a limp or a problematic issues in your individual sides, left or right side. So what should we do? First of all, how should we check this? So you can do some functional movements to check this. One is, try to, wherever you are, try to lift up your one leg, okay? Just stand on one leg and see the balance. I'm right now standing on one leg, and check the balance in your body. So try to see which leg is more comfortable. So when you stand, see the balance in your body and see how you're feeling, okay? Do it very slowly, do it in a slow movement. So you will come to know which side of the body is more balanced for you. And or you can stand against a door. For example, I'll just show you. So I have a door. You just stand against a door, okay, and check the gap between and your back. So if you check the gap between your spine and your back, there should not be a lot of gap. There should be some gap, but not a lot of gap, okay. So check the gap between your spine and your back. So let us now discuss what are the various exercises that we should be doing in order to have a pain-free pelvis. Okay, so the very first exercise is doing deep breathing, belly breathing, okay, or diaphragmatic breathing. So belly breathing helps us to, bring our abs and our lower back in balance. Okay, so the muscles in our abs and in our lower back in balance. So do deep breathing. So deep inhale, hold that inhale, and deep exhale. So when you exhale, try to contract your stomach as much as possible and try to touch it towards your spine. You will see a pressure that will develop in the lower part of your abs. So that's the right way to do the inhale and exhale. The second exercise, you will see it somewhere on the screen, and that is called as sitting knee pillow squeezes. So when you do a sitting knee pillow squeeze, then you tend to open up your sacroiliac joints. So this is done by putting a So let me just show. This is done by putting a pillow between your legs and squeezing it while sitting with an arc in your back. Okay. So when you squeeze the pillow between your legs, so these are our hips. Okay. So when you squeeze the pillow between your legs, it opens up the joints in your sacroiliac joint. Okay. It opens these joints and that relieves your back pain. Okay. So sitting knee pillow squeezes is the second exercise. The third exercise is cobra pose. Okay. So bhujangasana. So bhujangasana or cobra pose helps you to have a flexion in your spine. Okay. And opens up the disc space between your various vertebrae. The fourth exercise is try to do bridges. Now, bridges are sometimes very difficult when you have pain in your hips. So if you're not able to do bridges, then skip it. Okay. I would suggest that if you're in pain, then don't do bridges. Instead, try to move your legs in a like a viper. Okay, just move your legs lying down, move your legs like a viper. If even that is very painful for you, then bend your legs and just move your knees, drop your knees side to sides. Okay, just bend your knees and drop your knees side to side. So these are some of the exercises with which you can remove the dysfunctions in your pelvis and bring it in a neutral position. So I hope this video gives you some insights on how your pelvis is structured and what are the exercises that are needed to be done for it. Till next video, let's keep rebuilding a pain-free life.